someone tell me if they can see
Yeah,
them?
okay. I can see the slides and I
Great.
can see that people are entering the room as well. So hello and
Hello
welcome.
everyone.
Yeah, great. Yeah. Good to see you all. We'll give people a few minutes to log in. So we'll kick off at sort of 5 past the hour. So just bear with us for a few more moments.
Nice day. We'll go out in the sun later.
Yeah, it is. It is. Well, I'm sat here wearing the thickest sort of winter jumper. So
Oh
I'm
no.
missing out. I've got the blinds closed as well, so I don't really, yeah, I'm
I
not
think
really
it's quite
taking
cold
advantage of
though
this.
still, isn't
It's
it?
still quite cold.
Yeah.
My office gets the sunlight all day, so it's really nice, but it's also, if you have the window open, incredibly loud, usually with students screeching outside. So I get to choose between a bit cooler but noisy, or
Yeah.
very hot but quiet. How many are we at?
28 it looks like.
Yeah, great. For those people just joining, we're just going to give it a few minutes and start at 5 past. No problem, Matt. Yes, it is being recorded, isn't it, Vessel?
Yes, that's right. So it should automatically come to your inbox, but also we'll send an email post event. It will be uploaded to our YouTube channel too. So yeah, if you have to sort of head off early, then you won't miss that. It'll be a chance to catch up.
See some familiar names. Hi, people.
Okay, so it is 5 past, so I think we'll get going. So yes, hello and welcome everybody to this seminar organised by the Centre for Immersive Technologies. It's a cross-faculty research sort of institute at the University of Leeds. And we're going to be talking about some of the work that's been done in partnership with a few sort of organizations. We'll go through those in a few moments. And I'm going to pass over to Dr. Rachel Coates, who's an associate professor in the School of Psychology at the University of Leeds and expert in sort of aging research. So I'll hand over to Rachel, who will chair the session, and then we'll go through our sort of speakers in turn. So over to you, Rachel.
Thanks, Vessel. Welcome, everyone. Thank you for coming. It's going to be a really interesting few presentations for you today. So this is the agenda, if I can get my screen to actually move. Also, I should say I've come into the office today particularly for a stable internet connection, but there's drilling going on, so I'm hoping it's well-timed drilling, but we shall see. So this is what we're going to do today. So I'm just going to do a really brief introduction and then introduce you to the first speaker, which is Hanif Malik. And then we're going to have Becky, Joe, and then Mike, which is a recording, and Sam Rooker. And these people are obviously from various different institutions. Hanif is from the Park Lane Foundation, Becky's Leeds Hospitals charity, Joe from Bradford District Care Trust. Mike is going to be talking about dementia cafes. He's from Alzheimer's Society. And then Sam is talking, he's from Reprio VR, sorry, that's an error on the slide. So Sam's from Reprio VR, and he's going to be talking about a pilot study with Alzheimer's Society. And then we will wrap up with a Q&A and launch a report that we've written on all the work that we're going to be talking about today. That report will also be emailed to you after this event, but there's a QR code if you want to download it now. Any questions, feel free to put them in the chat, but I think we'll probably save questions to the end. So hopefully, yeah, put them in the chat anytime, but also we'll take questions from everyone once we've finished all the talks. So just to kind of give you a bit of a flavor, a bit of an introduction in the type of thing we're going to be talking about today. I'm sure pretty much everyone here is aware of these kind of broader issues. But mounting challenges in dementia care is kind of this obviously huge theme at the moment. And dementia care systems are facing increased pressures, not just here, but across the world, with rising cases. We all know about the aging population, limited effective treatments, and struggles to deliver personalized, enriching support for those in moderate to advanced stages. And we're going to be talking quite a lot about personalized support and culturally sensitive support throughout. And much of what we think, like as a group, that could be particularly helpful for people with dementia is looking into options with virtual reality, so VR and XR kind of solutions. And obviously advances in VR offer new ways to enhance dementia care by promoting reminiscence, social connection, emotional well-being through tailored immersive experiences. And that's what you're going to be hearing quite a lot about today, using these kind of systems with different populations and in different settings as well. So I will pass over to Hanif now, and then we can come back kind of together at the end for questions. I'll stop sharing.
Great, thank you, Rachel, and good afternoon, everybody. Apologies if I sound slightly croaky over the next 10 minutes or so. I don't have the luxury of being able to take any sips of water with it being Ramadan, but let's see how we go. So as the title there says, I'm the director of the Park Lane Foundation. My own background for over 25 years has been the third sector, or the not-for-profit sector. It goes by sort of various different names. And so although I've had a lot of insight into public health, this has actually been a really fascinating piece of work to be involved with. So as we were saying in the pre-session, most of us will be doing our Chris Whitty impersonation over the next hour, for those of you who remember him from COVID. So next slide, please, Faisal. So what we know is that dementia disproportionately affects people from minority communities, and our own interest actually stemmed from the fact that the Park Lane Foundation is the charitable arm of a family-run group called the Park Lane Group, and their mother in her 80s has had dementia now for several years. And what their personal experience and our own evidence, and indeed sort of my insight from these communities tells us, is despite that disproportionate impact, existing services are often failing to meet those cultural, linguistic and social needs. So we decided, as I said, to work along with Faisal and the team at the University of Leeds to fund an intern. And that collaboration has really enabled us to explore how VR could potentially offer culturally relevant solutions. And we think this is a really, really exciting area moving forward in terms of potential interventions outside the norm of what has happened in the dementia space over the last 10 or 20 years. So next slide, Faisal. So in terms of the challenges, the situation in minority communities mirrors that of society as a whole, i.e. We've got an aging population. Where there's a slight differentiation is that this aging population, for want of a better phrase, has arrived almost en masse. And what I mean by that is if you look at my parents, they arrived here in the early 60s. And so that period, which you'll be aware in the Afro-Caribbean community is known as the Windrush generation, but largely these are economic migrants that arrived from the old Commonwealth countries, mainly in the late 50s, 60s and the early 70s, and largely as sort of fairly young people of working age or even younger. And so what we haven't had to deal with in this country before is really an aging population who derive their origins from, as I say, those minority communities. But all of a sudden, in the last 10 or 15 years, we've got this very significant sized population of people in their 60s, 70s and 80s that are now causing, as I say, some fairly difficult questions for public health, for statutory organisations, for care providers. And what this is really going to require, as I say, is solution or solutions that mirror that new situation. Alongside of that, we've also now beginning to see, in terms of what I describe as third generation, i.e. my daughter, me being the conduit between my parents who arrived, me being born in Leeds and my daughter, and even the fourth generation. So to a large extent, the term that was often used in healthcare and social care was the extended family support network. And for the best part of 4 or 5 decades, that largely ran true. Most minority communities, not all, didn't have an over-dependency on social care, healthcare, or even private care as there is now, because it was the norm in those family networks to expect children and grandchildren to provide that type of support. And that's interestingly why we saw during this particular research that in terms of primary and secondary care settings, sometimes it was difficult to directly engage with older people and even users because they're still, to a degree, being cared for within a home setting. But just as sort of the economic environment and those pressures are beginning to impact on society as a whole, that's the norm now for all communities. So what we began to see again over the last 10 or 15 years is within families, for example, both partners having to go out to work. Traditionally, when I was growing up, my mother wouldn't have gone out to work. She was what we would have maybe called a traditional housewife. And then with my sisters, there was an expectation again that they would prioritise family care and parental care over in their own careers. That's no longer totally the case, although it's still prevalent. It is now beginning to show its initial signs of erosion. And as we move forward, that will become even more profound. If we add to that many of the cultural and linguistic barriers that we've got, and again, an interesting aspect of this particular research was even the reluctance of some of those individuals to put on something like a VR headset because the whole concept is just totally alien to them. That gives you a little bit of a flavour of, say, the challenges that we've come across. Next slide, please, Faisal. So, what is it we want to achieve, not only as a foundation, but as this collaboration that we've come together at? Right at the outset, what we need to do is really raise awareness of these disparities that are there. There's increasingly more evidence emerging to actually begin to verify and substantiate what I'm saying. But it's still really very much what I think is the beginning of a journey. On a more positive note, as I just said, this whole area of being in this digital age and the potential of VR is hugely exciting as something that might begin to provide culturally sensitive interventions. Just as an example of that, some of what we've discussed is for example, some of the content being more related to people's cultural background. So, that might be something like cricket for people from the South Asian Afro-Caribbean community who are huge cricket lovers. It might be Bollywood rather than Hollywood. Its music might be less the Beatles, but more
Thanks, Hanif. Fantastic. Becky, I believe it's over to you.
It is. Let me just share my slides.
I'll let you know that something's... Yeah, all good.
Oh, you can see them before me, I think. Brilliant.
Look at that. Impressive.
I know. Thank you very much. It's lovely to be here and to be a part of this collaboration. My name is Becky Baldarabooth and I'm head of grants at Leeds Hospitals charity. A little bit about who the charity is then. So we're the charity that champions and supports and gives thanks to the NHS. We bring together thousands of supporters and donors across the city of Leeds and more widely within the region, West Yorkshire and Yorkshire, to support Leeds teaching hospitals. And it's through this support, funding, collaboration that we have the opportunity to fund life-saving equipment, treatments, research, innovation and home comforts. There's so many different projects that I could talk to you about in terms of the initiatives that have taken place through the support from people across the city. Since we launched our 5-year strategy, which was back in April 2021, we've been able to provide an additional 24 million of funding to Leeds teaching hospitals. Again, across a range of different initiatives, projects, health and wellbeing, specialist staff members, some great innovation and research projects. We have been prioritising those projects that seek to tackle health inequalities, and care of older people has been a particular focus for us. We've also been very keen to invest in innovation and health technologies. Lots of you on the call will probably already know that Leeds is very much aspiring to be a centre of excellence, and very much is already in terms of medtech and innovation companies through the Innovation Pop-Up and Nexus, and bringing together academic partners, industry, the hospital trust, and really maximising those opportunities, that skill and expertise that Leeds has already, but building on that. Treatments and care of rare conditions and diseases is another area of focus. So you can see how the project today that Hanif has introduced very much aligns with the priorities of the charity. So it's been really exciting for us to get involved with it. Our approach to funding and I guess collaboration is underpinned by our values as a charity, which is all about transparency, working together in partnership really to transform those outcomes. And we identified at the start of our 5-year plan the inequalities that are present within the system. And we're really committed as a charity to equity of access and inclusive approach, recognising that how things are currently delivered doesn't meet the needs of the whole population in the way that they need to be supported. So that's a thread really through all of our funding and how we approach and work with the trust to identify where we can really maximise and bring about change. So since April 2024, the estimated number of people living in Leeds aged 65 and over and living with dementia is 8,807. And then overall, including all ages, it's over 9,000. So what this means for Leeds Teaching Hospitals as the acute trust that will support a lot of these people is that in a year between April 23 and March 24, over 5,000 patients were admitted to the hospital with a dementia diagnosis. And the majority of these people are treated at St James's Hospital and tend to be people that are in hospital for lengthy periods of time. It can be quite a complex acute stay. We're really proud to have worked closely over the past year with Ali Raycraft, who's on the call, I believe. She's the lead nurse within the hospital for older people. And we've been able to support with funding for different projects to improve the environment for those patients. So from therapeutic cats and dogs to dementia clocks, to activity boxes to stimulate and distract and support those patients. And we're really proud of those projects, but we know that there's so much more that we can do in this space, and that's where collaboration opportunities like this come. More recently, we've been able to work with Ali to fund the Happiness Programme, which is with an organisation called Sociability, and it's thanks to a very kind donation from the Park Lane Foundation that actually we were able to support this initiative. So it uses immersive technologies, not in the VR sense, but like technology that allows patients to work on their own, work with a member of staff, work in small groups, and you get these beautiful light displays which are interactive. So in terms of bringing a moment of joy, a moment of distraction, something that takes you away from the fact that you could be in pain, that you're sat in hospital, that you're confused. And there's two units that are now being used at St James's and have been really successful in the trial. What was really good about this one, and there's still a piece of work ongoing, is thinking about how culturally relevant content could be developed through the light technologies that would mean more to those patients. So we're really thinking about the inclusivity and the accessibility for all of those patients. And that was something that was important to us, but was certainly important to the donor as well. Through our partnership with the trust, so the hospital trust and the innovation pop-up, we have been able to provide funding for what's called the Leeds XR Hub. So this is really the springboard to XR within the hospital setting, and that's enabled XR to be supporting surgeons in terms of surgical planning, for patient and family education, for staff education. And then more recently, we've been quite heavily involved with the Children's Hospital and thinking about how we can use VR within the context of children, not just in terms of the distraction and sort of entertainment piece, but actually supporting with interventions and procedures where historically it's been very, very difficult to get a child to sit still and not be scared of a needle that's coming to them. But actually, how can we deliver this treatment without taking a child for general anaesthetic? So we're seeing how it's working really well within other areas of the hospital. And there's been some research that's taken place with Starlight Charity about the phenomenal success of this in terms of children. So we're already talking not only with this particular group, but other areas, M&D, patient groups, and other groups that are treated on the complex rehab ward up at Chapel Allerton Hospital. We know within the NHS that innovation is not the thing, that's routinely funded. finances are really, really difficult, as you all know on this call at the moment. So a great role for us as a local hospital charity is to be able to provide that pump prime, to be testing out new ideas. And it's so important that we can come together as collectives like this and think about the opportunity to begin to change things. You know, the population in Leeds is facing some of the highest levels of deprivation across the country. We've got a quarter of the population that are living in some of the most poor areas. And actually, it's the inequalities of certain populations that are already disadvantaged that are then leading through to poorer health outcomes, and then are needing the services within an acute setting, and then after that, thereafter within a community setting. And as a charity, we firmly believe that innovation, if used in the right way and the most inclusive way, has a potential to answer some of those really challenging problems and to improve the experiences for patients. On a really personal note, actually, with a father that's elderly, experiencing significant health problems, I can see the power of reminiscing and culturally personalized material. You know, you talk to my dad, who was an athletics coach, about the Olympics back in 1972, and he'll be able to suddenly return there and answer every single question. And there's lucidity and focus and clarity at that, and you know, joy and sort of focus in the eyes. And actually, for patients that are really struggling within a clinical setting, there is a potential to transform through the use of technologies. So I'm really excited to be here on behalf of the charity and to be a part of this conversation. And as Hanif said, it is the start of a journey, actually. And the report today gives some really great recommendations, but also to kind of advocate for the power of change through innovation. Thank you.
Thank you, Becky. It's great to just see, you know, the feasibility of all this kind of within the settings that are like right here. Over to Joe next, I think.
Okay, hi everyone.
Yeah.
I'm Joe from Bradford District Care Trust. I will see if I get this working. Can you see some slides?
Yeah, yeah, we can see slides.
Okay. See.
You go into
Right, so is that full screen now for everybody?
Yeah, that's full screen.
Okay, I'm gonna oh, I don't know how you share the sound again. Right, okay, hopefully you can all see that. I'm going to explain a bit of background first as to sort of how we've ended up here. I've ended up here. Oops, hold on. I'm going to figure out how to move on to the next slide. Okay, so I'm an occupational therapist at Bradford District Care Trust. I'm not an expert in dementia, and the project I'm leading is very much not centered on the VR. Project I'm leading is all about green therapy or nature therapy, and getting our patients out into nature more to improve their mental health. So usually, you know, my day-to-day job isn't necessarily around VR. It's doing things like gardening, or yesterday we were canoeing out with patients for their mental health. We didn't make it all the way to Leeds, I'm afraid, but we'll try next time. So yeah, over the past year, which is I've been in the job a little over a year. We've been looking at different ways that we can get people connected with nature. So it's not just about getting people out into nature, although that is obviously, you know, the ultimate aim. So one of our issues was that we have a lot of patients on wards who, for whatever reason, can't get out into nature. And so we've sort of grappled with, well, how do we find a solution to that? And that's when the VR came in as a solution to bring the nature to them, if you will. And we accidentally ended up with the headset. It was actually the company who made these videos were working with a completely different department, trying to make some different videos for us. And they just happened to be showing us what they'd done in the past and said, oh, we made this for a NHS trust down in London. And that was specifically for this trust's dementia ward. And it was essentially videos out in nature, VR videos, using, I think you can see the student there wearing a Pico 4 headset. So this original program that we then borrowed for like 6 months, been developed for NHS in London for their dementia ward. But it fit in perfectly with my project because it was, yeah, just sitting out in these different locations down in the south of England. I say one was like sat on a hill in Somerset, one was in the woods, one was by the seaside in Devon, and one was by a lake. And it might differ slightly to other sort of VR programs that I've seen, in that you could move around within the location, but you had to use the sort of controller to do so. But you would remain seated throughout. So yeah, we used it for nature connectedness, essentially. So we have used it not just on our dementia ward, but across the trust in lots of different mental health settings. And essentially it went down, you know, our initial trial of 6 months, it went down so well that we decided to get our own videos made, because as somebody has already alluded to, there's sort of the reminiscence factor. We thought it would be more relative if it was places that our patients would actually recognize. So, oh, sorry, I think I've skipped forward slightly. I'll talk about this first, and then you can see what our new videos look like. So yeah, we only did very sort of limited trials when we were trialing it on our dementia assessment unit. And we were very careful with who was selected to take part, but I left that down to the staff on the ground who obviously knew the patients a lot better. We made sure it was a quiet room because one of the main selling points, something that they really enjoy is the sound, the 360 sound, which really grabs people. So we had to make it a really quiet room, 2 members of staff present. So we had 6 patients try it, and essentially what we discovered was that there were no sort of issues with wearing the headset. There didn't seem to be any issues with using the controller, although that's not a huge barrier anyway, because you can just remain seated in the one location. There's no, you don't have to move around. Most people used it for about 15 minutes. 2 of them used it for over 25 minutes. People were able to move around fine. Everybody seemed to like being by the beach the most. So I don't know if there's something there about the sound of the sea, or just, the reminiscence of childhood holidays to the beach. And everybody who took part wanted to use it again. So that was our main findings from that. So yeah, what we discovered was that it had quite a profound impact on especially the patients who had previously been quite aggressive and agitated. So we had, I know the OTs on the ground were quite surprised at what a calming effect it had. And obviously, like I say, I don't work on these wards usually, so I didn't realize that just 10 minutes previously, they had been quite aggressive towards staff. And then they put on the headset and suddenly were really calm, relaxed, and just enjoying being in that VR setting. And yes, the reminiscence factor, as we've already talked about, they started to really open up about their childhoods and just chat to staff a lot more than they usually would, and start chatting to them about, well, where am I now? And would start talking about, is this, the beach over at Whitby or wherever, and it really opened up those conversations between staff and patients. So anyway, because it had such a positive result, we did get our own made around West and North Yorkshire, and I'm hoping you might be able to see a video of it if that is working. And if you can hear anything, you can sort of get an idea of what our program looks like when you're in the virtual reality.
We can see it, Joe, but I don't think there's sound, although it is noisy in my office, but we can get a good picture of what it looks like.
Okay. Well, if you could hear the sound, it is really impressive. And, I'm sure if you've tried virtual reality, you'll know. But, the thing that really sort of got our patients' attention was when you can hear a sheep behind you and you turn around and the sheep is there. That's what really makes the difference. Right.
Yeah, the
anyway.
sound came through just at the end.
Okay.
Yeah,
right.
it was lovely.
You've got a bit of sound, right? Thank you. So yeah, I'll just talk about. So yeah, we got these videos made because of the positive feedback, and we now do own two headsets of our own. These videos, are for us to use. 5 locations across Yorkshire, so Malham, St Ives, Cowan Carr, Ribblehead, Bolton Abbey, I don't know how familiar people are with these locations. I'm sure a lot of you have been to them. The only disadvantage was that we did lose the beach in Devon because it's not really that local to us over here in Bradford. But potentially going forward, we would really like to get a seaside location. So here's just a slide with some pictures in case you missed any of it, but there are 5 locations there and how you choose them with a controller. So yeah, some of the barriers, use of the controller, that I think is going to be a barrier. But again, you don't necessarily need to move around locations. You can just remain seated and still appreciate it. The technology, the one that we're using, it has lines from both controllers going across the screen, which can be quite distracting. And as far as I can work out, there's no way to turn the other controller off that you're not using. So that can be a bit annoying, and patients do often ask about why there is this other line on the screen. I'm sure it's the same with every VR headset. You have to set a boundary when you first use it, which means that everybody has to sort of play musical chairs and keep swapping around unless you want to keep resetting the boundary. It also took me a long time to get it through infection prevention because they weren't happy with the headset as we first had it. So we had to replace lots of parts with ones that are easier to clean. So that's basically what we did and where we're at. Going forward, we currently have the headsets. They're available in our main library. Anyone can take them out. They're not being used much on our dementia ward because of staffing issues, essentially. So we're kind of currently investigating, what can we do about that? One idea is to make it sort of a student project to get the students more involved. We are using them still on the other wards, and they go down brilliantly in, say, relaxation, mindfulness classes, things like that. I have been contacted recently by a lot of local care homes who want to start using them as well. So that is another possibility. We'd like to make more videos. If we could make one by Whitby or somewhere in Yorkshire by the seaside, I think that would be brilliant. You might have noticed quite a lot of our videos do have water featured in them, but it's still not quite as good, we found, as being at the seaside. And yeah, just looking at the other possibilities of the use of VR. And I should mention as well, which I've not put in the slides, as part of my bigger project, I work really closely with the Canal and River Trust. And I don't know if you're aware, but they use virtual reality as well. And we had them do a whole program of activities on our dementia ward. And one of those sessions was using VR to access the canal boats, which again seemed to go down really well. And they had no issues at all with people doing that. So that's it. That's us from Bradford. Thank you.
Thanks, Joe. That's great. It's really nice to see the specifics around like what works or what's like maybe a bit of a barrier and stuff for people wanting to do this work. There's some comments in the chat, but I'll wait till the end if that's okay, and we can do all the questions together. I'll keep an eye on at what time they came in, and therefore probably relevant to you. Well, yeah, you can have a look now. Okay, I think it's a recording next from Mike White, who's from Alzheimer's Society. I'm hoping Faisal's going to do some technological. Here we go. Anyone got any questions about his guitars? Feel free to put those in the chat as well. I can't answer them though.
Yeah, thanks, Rachel. So hopefully the sound will come through in a second. So let's go.
Yeah. Hello.
Yeah,
it's working. Michael White, and I work for the Alzheimer's Society. I'm a regional manager, and I cover South Yorkshire, Nottinghamshire, and Lincolnshire. I'm sorry I can't be there today with Sam and Recreio VR to support this event, but more than happy to talk for a few minutes about some of the work that we've been doing at Alzheimer's Society with Sam and Alex at Recreio VR over the last couple of years. So the Alzheimer's Society has an accelerator program where we take and support take applications from accelerator partners who are developing new technologies, new products, and we will support them over a period of a year with financial and business investment to help them build up their product and then endorse it further to further benefit people affected by dementia. And Recreio VR was one of the accelerator partner products that we supported. And I was asked, given my role as a regional manager, to help support Recreio to evaluate their headsets for people affected by dementia across the northeast of England and North Yorkshire, which we did with our teams. And Sam and Alex provided the headsets, the VR headsets, and we used them in our cafes and groups through an evaluation program. The result of that evaluation program was overwhelmingly positive, and I'm sure Sam can talk in more detail about that. But we found the experience that people reported extremely positive, and there was some good learning that came from that in terms of different functions that the headsets could use, and making the app on the platform a little bit easier to manage. But that was really what kind of piqued my interest as a regional manager in the Alzheimer's Society for continuing to work with Recrio beyond the accelerator programme period. So since the completion of that evaluation, we've signed up for the North East and North Yorkshire and North Cumbria region. We've signed up to a 3-year agreement with Recrio to provide a number of headsets for us across the region, where our staff and our volunteers will go in and use these headsets periodically with people affected by dementia, with their carers present as well, usually. And our volunteers and our staff are all trained in how to use the headsets. What we've found is that people often report back that they find the headsets extremely stimulating. They find them good fun to use. After initially was talking through what the headset is and how it works, because people do have this stereotypical view, shall we say, of a headset being a roller coaster ride or something scary or something that's going to make you feel dizzy or disorientated. And we've developed with Recrio a kind of a toolkit for the person helping that person with dementia. So talking about what the headset is, explaining that they'll be sat down while they're using it, they won't be moving around, they'll still be able to hear the world outside as well as hear what's in the experience. And then just talking through what's on the menu there, what type of experience they might want to look at, and what they might like to see. So, as I say, people are reporting that they're very stimulating, they're good fun. We're finding that people find a real benefit in the reminiscence value of looking at a certain environment. So it could be on a beach, hearing the sea, hearing the wind, watching horses run down the beach, that kind of thing. It can stimulate lots of memories, lots of experiences from the past where people have been on the beach in their younger years, for example. There are other certain more specific environments, such as the steps at Whitby up to the Abbey, which is really popular one we found, and lots of people around Yorkshire and the North East have been to Whitby, remember going there either when they were small or quite recently, and really feel the benefit of that and enjoy that. So lots of different experiences that are there. We find that also with the use of an iPad, we can share, or the person with dementia, the person using the headset can share the experience with someone else looking at the iPad. So that gives a sense of they're both looking at the same thing together. And that can be really valuable, and people really enjoy that. Also helps that shared experience for people to look at things together. And because of the way that Recrio designed the experiences and the headsets, it's immersive, but it's not too immersive. So we were initially concerned that an immersive VR experience might disorientate someone with dementia and leave them feeling upset or leave them feeling distressed when they take the headset off. But we haven't found that at all in using the headsets for people with dementia, because you can hear the outside world around you. So you can hear people stood next to you, you can hear the sounds of the cafe that you might be in or the group setting that you're in. You can also hear the sounds of, let's say, the beach or the experience that you're watching, and you can hear the two. So that sense of I'm watching this thing, but I'm still sat in reality, really works quite well. The design of the headsets with the battery at the back and the visuals at the front gives a nice sense of balance, so people don't feel like the head's being pulled down. And that's not to say some people have looked at the headsets and thought that's not for me. But what we often find is when they see other people using it, they think, well, I'll have a go then, I'll have a go. And I've seen people myself really welcome that experience and really enjoy it. I've had a few quite emotional experiences where people are, get quite emotional, a little bit of few tears about, the fact that they've gone back to Whitby, the fact that they're, back on the beach and experiencing it. And, but it's overwhelmingly positive in terms of people really glad they experienced that. And we've had lots of requests for further sessions with people all across the region in which we work. So in terms of the applications that we're using with Recrio, we're using it in our dementia cafes, in our dementia groups, things like cognitive stimulation groups that we're running in different parts of the region. We're also using them for things like Dementia Action Week. We can use them in events, conferences, and what have you. And the nature of which the experiences are being filmed as well. It's great to work with Recrio on developing some new experiences to gather the feedback from people using the headsets, to ask them what they would like to see next. So that's generated some great ideas and some great plans to move ahead and film in different parts of the country. And we've also got some ideas of the more inclusive experiences as well. So being in Whitby might be great for a lot of people, might not be great for other people who might be from different cultural backgrounds. We need more inclusive cultural reference points, really. So we've been particularly interested in exploring that a little bit further for things like maybe a VR experience of an Asian wedding. Perhaps, different kind of community places, different marketplaces, say, in a certain community, or even in a mosque or similar. So we're looking at, speaking to people from different communities to kind of say what kind of ideas do you have, and how can we take that further? So filming days are built in, and we'd like to get people with dementia involved in choosing which ones those are, because we can't film everything, can't film all their ideas, but having a panel of people to take this further with us would be great. So in a nutshell, we really value the work and the input of Recrio VR. It's become a staple, if you like, of our group offer, of our community offer. We really see the benefit that it brings to people. We listen to people when they tell us how much they enjoy it. And we'd like to continue to roll out the VR headsets across our organisation. So first of all, cover the whole of the north, then move across the rest of the country and the three nations, England, Wales, and Northern Ireland, in which Alzheimer's Society works, and of course promoting Recrio VR with any other expansion ventures and working with other third parties as well. We're absolutely fully supportive of that, because ultimately benefits people affected by dementia. So thank you very much for listening. I hope that's been helpful, and I hope you enjoyed the rest of your day.
Thanks, Faisal and Mike. Yeah, fantastic. I think he's kind of set you up nicely, Sam, hopefully. So Sam's from Recrio VR, which is the company that Mike was talking about that's been working with Alzheimer's Society. And Sam, do you know if he plays guitar or?
I think it's quite a good flex, isn't it, having all of those behind him? Usually, every now and again, it's blurred. So I'm glad that he unblurred his background so he could show them off for everybody today.
Just for us.
But yes, thank you to Mike for that.
Oh, he does.
We've had
Someone's
a really
put
good
it in
time.
the chat. Someone's got knowledge. He's a guitar player. It's not just for show.
Yes,
stuff.
Exceptionally well. I'm yet to hear him. I might have to ask him on the next Teams call with Mike if he'll pick one up.
Okay.
But
over to you, Sam. Do you want to, I'll check if your slides share.
Yeah, if you could, thank you. I'll just
We're doing very well for time, by the way, everyone. I'm impressed. People are keeping to their slots. That's no pressure, Sam. You can take extra if you want.
I'm struggling to see. There we go.
Yeah, there you go.
Cool. Okie doke. Yeah, so time I won't take too long. So thank you to Mike for that. And yeah, thank you to the cohort really for including us in this. And it's really interesting to hear everybody talk about their experience. And one thing that when we first sat down with Faisal and Rachel and the team, when I discussed our experience of using VR with people living with dementia, everybody seemed to have similar points, which we all agreed on. And it was really nice to hear those sort of spoken about there. But yeah, I'll give you a bit of background about us. So we've been providing headsets to care homes now for about 4 years, with a focus on people living with dementia and reminiscence. So I'll give you a bit of background as to why we wanted to innovate in this area. I had an experience. My nana was living with dementia in Hull in a care home, a specialist dementia care home, and had been non-verbal for a period of time. And my granddad had convinced care staff to allow him to take her out for the day. And he wanted to go to the beach. He wanted to go to Hornsea, just on the coast near us. And he needed somebody to help get her in and out of the car when we got to the beach. So he enlisted my help. So I went along with him. And as we were driving along country roads to Hornsea, and when we got to Hornsea itself, she was just alive, looking out of the window, pointing out and trying to communicate with me and Grandad, smiling all the time. And it was such a change, something that we hadn't seen while she was in the home for a period of time. We were both quite shocked and emotional. So essentially what we wanted to do is replicate that experience, but using virtual reality. We know that a lot of people don't have access to people that can then take them to sort of places that they recognise and leave the home in certain conditions. So we want to sort of replicate that effect using virtual reality. So we've obviously, with that focus, we wanted to really design our service from the beginning for use with people living with dementia. And that included a number of things. So we looked at hardware. Like Mike mentioned, actually, the headsets that we use have the battery pack at the back of the headset. So in comparison to some MetaQuest headsets where everything is in the front, it's not pulling forward on and making people lean forward with the weight at the front of their heads. So it's evenly balanced. It allows us to sort of sideload our virtual reality app that we've designed onto the headset. So we're very aware that we're going to be asking, activities coordinators, wellbeing teams, lifestyle managers in care homes to use headsets with elderly adults. And we wanted to make sure that there was no barrier there. And that meant designing an app which was gaze navigation based without controllers. So again, we wanted to make sure that people were able to access experiences as easily as possible. We also wanted to make sure that the user wasn't actually selecting videos themselves. So the headsets that we provide are used in carer-led sessions. So a carer selects a video for an individual. When they take the headset away from their eyes, the experience pauses. So then they have as much time as they need to actually approach the individual and help them put the headset on themselves, and they're immediately immersed in the experience. They're not having to use those controllers like sort of Joe mentioned, with the lines sort of being quite distracting to a certain extent. The actual experience itself will move independent to the individual. So for example, if we're going to Whitby for an experience, it might start at the top of the steps, and after about 40 seconds, 50 seconds, the experience will move on to next to the whale bones, for example, for a different part of Whitby, but the experience fades to black and then starts at a new location. So there is still that sense of being able to move through a location, but it's not, we're not asking and asking people to sort of navigate themselves. The content, obviously, when we started out, we realized that we needed to create our own content. There's lots of VR content out there that you can license, but not all of it, I think, is suitable for people in care settings, especially if it's their first time using VR. So we record about 90% of the experiences that we provide to organizations. The camera is always at a stationary viewpoint, roughly at about a sitting height. So it's almost as if somebody is in the lounge of a care home, for example, and they sat in a chair, they put the headset on, and they're still sat in that chair, but they're not in the lounge anymore. They're sat looking at the experience in front of them. And all of this was to sort of negate the effects of cyber sickness, essentially. We didn't want to have movement, point of view changing, and sort of high visual flow, because we wanted people to be calmly immersed in the experiences and just sort of using it as a viewpoint to another world, really, another place. We also developed with caregivers, with people living with dementia, a process to actually using the headsets with individuals. So again, that selecting the experience for the individual and allowing them to just put the headset on themselves and be immersed in it completely from the beginning is part of that. We wanted to make sure that, yeah, it was as easy as possible for people to use, but also the way we approach people living with dementia, explain what it is, make sure that that individual is actually, wants to engage with the headset before they use it. All leads to people having a good experience with using the headset. Oops, I've gone backwards somehow. And yeah, in 2023, we became, 2020, yeah, 2023. We started working with Alzheimer's Society on their accelerator program, which Mike touched on.
Okay, well,
some background noise there, sorry.
Yeah, sorry. I think, could everyone just check that they're muted? I think somebody might not be. See if I can. Yes, I think I've done it. On you go, Sam.
Cool. Okay. And as you mentioned, it was very helpful to us, and we're incredibly grateful to a number of people at Alzheimer's Society. Paul Reynolds has obviously already sort of mentioned himself in the chat, but Sarah Ruff, who's there as well. We got amazing support. We got access to lived experience groups who helped us develop the content that we provide. So helping us to create a library of reminiscence content of places around the UK, places abroad that people will have been on holiday to, hobbies and interests that people would like to go back to and reconnect with. And also it gave us the opportunity to actually evaluate our service with people living with dementia, which then led to our sort of inclusion in this report, which is superb. So I'll quickly talk about that evaluation itself. So it was a feasibility study that involved over 100 people living with dementia. Around 50% were in care home settings, 50% were in dementia cafes. So that's where Mike and his teams helped us out. But we found some really positive results, sort of echoing what people have already said. 97% of people who were offered to use our headset actually took part, put the headset on, and on average watched around 3 to 4 experiences, so totaling around 8 to 12 minutes in VR. 92% of people found the headset comfortable. So again, as Hanif mentioned, there is that concern that people will find the headsets uncomfortable or claustrophobic, and that is just not what we've found in our experience or in this evaluation. And 90% of people enjoyed the experience. So in terms of care home experiences and activities, that's quite a high proportion of people actually enjoying the experience that they're being provided. And 86% of people wanted to have access to VR in their care plans moving forward. So we found evidence for aiding people to recall memories. So there was one experience where there was a 90-year-old lady in a care home who was watching an experience of a dog jumping in and out of a river fetching a stick. And she loved the experience and went through all of her dog owning history to like the 70s, explaining, talking about the different breeds and personalities of the dogs that she had in her life. We found evidence for improving mental well-being, but also that social side as well of connecting and sharing life stories. And crucially, there were no negative interactions with the headset when we were running this evaluation, this study. Nobody felt cyber sick and sort of motion sickness from the experiences. And yeah, everybody reported to sort of, yeah, like I say, if not enjoy the experience, they weren't negatively impacted by using VR. And so, yeah, so our call to action as well, I guess, and what we want to do moving forward, I think creating reminiscence content for all is huge. As we've mentioned, a lot of people who will have come over during that time in the 60s and late 50s, who are now living with dementia in the UK, won't necessarily be sort of drawing on personal experiences in childhood of going to Whitby on family holidays. They'll be sort of wanting to connect with the places that they grew up and spent that time in their lives. So we would love the ability to to build a library of content with those individuals from different backgrounds, and make those available to people that are using our headsets. We're currently organising a feasibility trial in a dementia ward in Basingstoke, so in Southern Health NHS Trust, where our headsets will be used as in a study to see their effectiveness of improving well-being and general sort of well-being in hospital settings. So that's really exciting, and we want to expand that obviously moving forward. And we feel like there's more sort of room for evaluation, especially we've seen a lot of evidence for it helping people who are distressed and anxious. As sort of Joe touched on, we've had a number of experiences where people have been agitated, have been wanting to go home, for example, and confused in a care home setting as to why they can't leave. We've then used our headsets with individuals. There was a lady, for example, in a home I was in recently. She was in a corridor of a dementia floor, really getting quite irate at a member of staff asking why she couldn't leave and explaining that her husband was coming to pick her up. And she had a jacket on and a bag in her hand. And I sort of walked past and said, well, we're going to run this activity with everybody in this room. Would you like to have a little look? It'll take a couple of minutes. And she said, yes, okay, yeah, I'll come through. And she sat down. We were in the northeast. We were in a care home in North Yorkshire, so I'd loaded up Scarborough on the headset, so a tour of Scarborough, and within 3 minutes she was sat engaging with the rest of the residents and staff in the room. Her jacket was off, her bag was on the floor, and she was talking about sort of holidays that she'd been on with family, her young family when they were younger. To Scarborough, and explaining that it was something that she really enjoyed, and that individual stayed in the room for half an hour afterwards. So there's prolonged well-being and that we've seen from using our headsets after the fact of using and watching an experience. And so like I say, we try and create content that's appropriate to the individuals that are using the headsets. That includes local experiences and places that are person-centered to individuals, and we want to carry on doing that work and create an even larger library of content that will impact people across the UK from all kinds of different backgrounds. But yes, thank you very much for your time, and I will stop sharing now and pass it back over to Rachel.
Thanks, Sam. I will share my slides. It's just from my perspective, hopefully you can see I'm back on the agenda, I think. I just thought people might want to see a list again of who we've just heard from, in case you didn't manage to write any names down. Pastor, can you nod at me that that's what you can currently see? Yeah, great. Thank you, everyone, all the speakers. And it's great to see there's loads of positive and really interested comments in the chat. So it's really nice to see that all this work has landed, and people talking about collaboration and all that stuff. And I'll try and come to some of those comments in a minute. I will just try an attempt to kind of wrap up briefly before we go into a Q&A. From my perspective, it's been an absolute pleasure getting involved in this work with all the people that we've heard from today. It's fascinating stuff, and I think you'll all agree, really timely and necessary, and nice to see some of the kind of nuanced detail as well about what works and what might be best for kind of future plans. So I'm just gonna, if I can get the slides to move. Yeah, I just thought I'll try and get a few conclusions and then next steps and maybe another brief call to action. And we will follow up with all of this in the report that we're about to launch, so you'll be able to kind of read it in your own time as well. So I think it's really obvious from everyone we've heard from today that there's clear potential for VR to work and enrich dementia care, and that's in multiple contexts. So we heard like from both like Becky, Joe, this can work not just in communities but also in hospitals and for quite advanced stage dementia as well, which is obviously great news. We heard from Mike too, from Alzheimer's Society with regards to that. So community and hospital settings. And I think the main message that kind of came out is this idea of like the reminiscence and delight, connection. So this is something not I mean, obviously for people with dementia, but also for carers. And just to see someone actually experiencing either a moment of lucidity or just some joy is huge. Anyone with any personal connection to dementia will appreciate that. So it's really nice to hear about that work, and that there's kind of potential for all of this. And I also think it's really important to think about the specifics in terms of making sure this works, because a few people alluded to the fact that maybe there's a bit of reluctance, or this new technology is a bit new and a bit scary, but with the right support can clearly work. And so some of the things that Joe was talking about in terms of in making sure we can get past like infection control and that sort of thing as well. So designing things that work for older people, but also for the settings that they're in, I think is really important. Just a few things that we as a group would like to sort of do next. And we're also really interested to hear from anyone here. So if you're interested in collaboration or anything, please get in touch. The email address is at the bottom there, or with anyone that you've heard from today. Likewise, feel free to get in touch and we can put you in touch with other people too. We would quite like to, we're going to try and get some funding so we can do larger scale work and look at kind of multi-site trials and the capacity building kind of stuff, seeing if we can get this to work at scale and use VR in multiple different settings. And for different reasons as well. So maybe we can look at things like it not just creating a really positive experience for someone, but maybe it also means that they are more likely to stick to their medication, or, like how far does this go? We also want to be able to create modular and scalable content. So we've talked a lot about kind of Whitby and these various experiences. We also want to think about more culturally diverse experiences. And if we can create modules, like little videos, whatever, that we can then pick from and you can make it slightly more bespoke to whichever individual. So you can think, okay, they might want to do this tour of this place and they might want to go to this, kind of try and build things together that are more bespoke. We also understand the importance of community engagement and partnership. So obviously with co-design in mind. So if anyone is out there that would be interested in being involved from that perspective, then that would be fantastic. And obviously not forgetting inclusivity and accessibility. So like making sure that all this stuff that we're planning, that this technology that we're going to use is affordable, and that type of thing. So I think that's where we're like hoping to head. And yeah, like I said, we're really up for collaboration. So do get in touch. I will try and take questions now. I will have a look at the chat, but as well. But if anyone's got a question for anyone, that would be great. Just either put your hand up or unmute yourself. Whilst I wait for that, I would like to flag something that someone's put in the chat, which is from Sarah Ruff, who works at, she's a senior innovator from Alzheimer's Society. And there's an advert in the chat that she's posted for if people would like to join the Alzheimer's Society Dementia Innovation Showcase, which is on Tuesday, the 18th of March. I've signed up to that. So Sam, I believe. So we'll be there. But yes, just to flag that if everyone wants to look in the chat. Okay, any questions?
So Rachel, there is a comment, I think this sort of active conversation here between Joe and it's Buena around the use of sort of immersive rooms in contrast to sort of headsets that have been sort of focused on here. And so, Joe, just for sort of those who haven't sort of read the message, maybe briefly you might be able to say a bit about this, your thoughts on it.
Yeah, so Bradford University have one actually in their basement, and it's basically like a round room, and rather than you having a headset, everything is projected around you and even on the floor and above you. So as somebody's commented, it can be a bit more of a group experience. I mean, Bradford Uni were interested in us using it. Our problem was how we got people from our ward to a cellar at Bradford University. So we haven't quite figured that out. But that was really interesting. I don't know if it's quite as immersive as the VR experience, but you know, it would be better for maybe a group setting.
Yeah, I guess that's the sort of advantage with the sort of headsets, is that they're lower cost and more portable. I guess this is where the sort of focus was here. But yeah, it's interesting sort of idea.
I'm just looking through the chat. There's loads of people are going to be connecting and chatting and talking to each other, which is fantastic. But I can't see any questions that have gone unanswered. You just scroll through everything. Oh,
Yeah,
good. Sarah's delighted that we've shared the advert. Good. Phew. Yeah, I think Mel's had to leave, but just made a comment about positive anecdotal evidence for improving mood and well-being as well, which I think we've kind of touched on. I from my perspective, I think it's so wide-ranging. I think the possibilities for this, so like mood, well-being, but you know, beyond that, like I said, maybe just calmer and therefore more likely to stick to medication, like just that sort of thing. It would be interesting to discuss what is measurable through all of this, you know, that type of thing. But anyway, that's just my thoughts.
One thing that I just will mention here, actually, we've had anecdotal evidence of homes coming to us and saying that using our headsets with individuals has potentially stopped them from going down the medication route.
Oh, wow.
So
even better.
Like, yeah, using, and that's again something that we would like to do a bit more research into, but especially around PRN medication, and for those who are agitated and, you know, if we can stop somebody having to be given diazepam, for example, I think that's a wonderful thing that our technology can be used for. But again, that's something that we'd like to sort of explore further.
For sure. Okay, any final call for questions, and then we can wrap it up. Well, no, not everyone is going for lunch. Apologies for those who are doing Ramadan.
So Rachel, just one really quick one that's just come through from Krisha. I think that might be to Sam. How often were these sort of care homes using these VR headsets?
So it depends sort of individual to individual, but on a weekly basis. But some people are using it on a more regular basis, certainly. So we do a lot of work actually integrating our headsets into the activities that are going on in the home, which then allows it to be sort of used more widely with residents. But for those who are living with dementia, or those who are bedbound, for example, using a headset like this might be one of the only sort of activities they can partake in. So it's used quite regularly by the activities teams with individuals.
Great, thanks.
No worries.
Okay, I think all that remains then is to launch our report, where we cover all of this in kind of more extensive detail. So please do have a look. The QR code is there for you to download it, but if you, by attending this meeting or by signing up to it, you'll be on the email list. So you'll also be sent an email. That's an easier way for you to get it. So enjoy, and please do get in touch if any of this resonates and you want to be involved in work, or just tell us what you're up to. It would be great to hear from you. And thank you to everyone, all the speakers today, and everyone involved in getting this event up and running, and the production of the report as well, and the work obviously that's underpinning it. It's just great to see so much fantastic work. locally as well. Great. Okay. Thanks, everyone. Thanks for coming. Enjoy your sunny day.
Thank you.
Thank you.
Bye.
Thank you. Bye.
Thanks. Bye-bye.
Bye.